Hello, everybody. I'm Natasha. I'm going to be speaking about breast cancer on today. I will be giving key facts and treatment plans that are used from the start of your treatment into the end of your treatment. 1. What is breast cancer? Breast cancer is a form of cancer that starts in one or two of the breasts. The cancer starts when the cells begin to grow out of control. Breast cancer is known to occur in only women, but that is false. Men can get breast cancer also. Here's an important fact to understand: most breast lumps are benign and not cancer, called malignant tumors or abnormal growths. These growths can spread throughout the breast, but not outside of your breast. They are not life threatening, but some benign lumps can increase a woman's chance of getting breast cancer. Any lump or change needs to be checked by a healthcare professional to make sure it is benign or malignant, if it might be infected or can affect your future cancer risk. Where does breast cancer start? Breast cancer starts and forms in the breast, in different parts of the breast. Breast is an organ that sits on top of the upper ribs and chest muscles. This is a left and right breast that has mainly gland ducts and fatty tissues. Breast in women produces milk and delivers it to feed babies. The amount of fatty tissue in the breast determines the size of the breast. So it depends on your sizing of your breast of how much fatty tissue you do produce, which can form and become infected to cause cancer. It gives the cancer cells more, basically a playground to feed on in layman's terms. So it's a playground that they can feed on. Some parts of the breast, you have the lobes. They are the glands that makes breast milk. Cancer that starts here is called the lobar cancer. You have the ducts. The ducts are canals that comes out the lobes that carry milk to the nipple. It is more common for cancer to form here. It's called ductal cancer. This is the form of cancer that I am currently fighting. It's a HER2 positive aggressive form. The reason for that is because it has more of your hormones located in that area as it produces the milk for you to be able to breastfeed your children. So it gives it more of a playground, like I stated before, to play on. Types of breast cancer. You have a sarcomas and lymphomas are a small number that cancer form in the tissues of the breast. The type is determined. The type is determined by the specific cells in that breast that are affected. Sarcomas are most breast cancers. Most women, most women and most common cancers are ductal carcinomas and invasive carcinomas are the adenocarcinomas, the angiocarcinomas, or just carcinomas that are not considered breast cancer since they start in different cells of the breast. So basically, carcinomas, lymphomas, and all of that forms in your breast, but is located in different sections. Some parts could be more cancerous than others. It could not be cancerous at all. It could just be a lump, like I stated before, malignant or benign. They just use all of these special words and phrases, carcinomas, sarcomas, lymphomas, just to make it seem more difficult and more worse than what just saying, oh, it's benign or it's negative. So it's just more of a breakdown of the wording that I just addressed to let you know about, if you hear those words, to look more into it to make sure it's really benign and that is not a cancerous cell that's affected. Classification of breast cancer by certain types of proteins or genes. each cancer might make. A biopsy is performed and the cells are tested for proteins called estrogen receptors and progesterone receptors and the HER2 gene. They also look closely at the cells to see what grade it is. Finding out the grade of the tumor and the proteins found help decide the stage of the cancer and what treatment plan and what options are best for the person. The spread of breast cancer. Breast cancer spreads when cancer cells get into the blood or the lymph system and then are carried to other parts of the body. If cancer spreads to the lymph nodes, there's a higher chance that the cells could have traveled through the lymph system and spread to different parts of the body. Treatment plans. There are several treatment plans. The one I will discuss is my own. The first stage of my treatment was getting all the tests ran. I got several biopsies, MRIs, a PET scan of my brain and my body, also a CAT scan and a mammogram. All these tests are done to find out which treatment should be best for myself and anyone else who go through these stages. The second stage for myself was chemotherapy. I had 6 cycles over 4 months of aggressive chemotherapy. I was receiving 6 medications to fight the cells that's cancerous in my body. Treatment lasted 8 hours every session. Third stage is surgery. In my case, I'm having a double mastectomy, both breasts removed on 1/17/23, which is tomorrow. Some people only get a lumpectomy, which is a partial mastectomy. After surgery, the doctors check the size of the treatment that was the tumor that was removed, and decide the next step if you will have radiation or chemotherapy. For myself, I have a higher chance of receiving radiation due to my cancer. Due to my cancer mass. My mass was really big and had spread to my lymph nodes. My final step is chemotherapy. It will be aggressive, but not so aggressive as the first 6 rounds. I will be going for 8 months to continue to fight off any cancer cells that might still be active within my body. In closing, here are some fun facts. 47% of patients have to tap into their retirement account to pay for out-of-pocket expenses. 26% uses their credit card. 73% considered altering or skipping their medication to save money. 41% actually has acted on it. 57% applied for grants or financial assistance. 40% are still in debt after treatment. I can understand these numbers. I fall in one of these categories. I myself depleted my savings account throughout my fight in the beginning. Every appointment, I was swiping my card, paying for test after test that my insurance should have covered, co-pays that's hundreds of dollars, but they tell you not to stress because it's not good for recovery and for your fight. But it's stressful to wonder if you can afford to be healed because the constant bills you have to cover along with still maintaining your current household in life. Breast cancer is not a death sentence. It is a new life for that person. You learn so much about yourself and learn to appreciate and live life like it's your last moments. Just being happy and carefree. New life and aspirations is the gift of survival. Thank you, and y'all have a good day.